And for the drug study, we have first the metformin. The classification is biguanides, and the dosage is 5 milligrams every 12 hours and per oral. And the mechanism of action is inhibits and alters both whole body and cellular energy metabolism, inhibition of hepatic gluconeogenesis. And the indication for this drug is diabetes mellitus, polycystic ovary syndrome. And the contraindication for this drug is hypersensitivity to metformin, CHF, diabetic ketoacidosis with or without coma, severe renal disease, abnormal creatinine clearance resulting from shock, septicemia, or myocardial infarction and lactation. The side effects for this drug is physical weakness or asthenia, diarrhea, nausea, vomiting, chest discomfort, bloating, abdominal distension, constipation, rash, metallic taste in the mouth, headache, weakness, dizziness, and drowsiness. The adverse effects of this drug is the gas or the flatulence, symptoms of weakness, muscle pain, myalgia, upper respiratory tract infection, low blood sugar, hypoglycemia, low blood levels of vitamin B12, heartburn, lactic acidosis, erythema, hypoglycemia, vertigo, agitation, abdominal pain, thrombocytopenia, tinnitus, fatigue, and anorexia. And nursing responsibility the nursing responsibility for this drug is metformin is the drug of choice for overweight patients for whom dieting has not controlled diabetes, can also be used in patients who are not overweight and when diabetes cannot be controlled with sulfonylurea treatment. Advantages include lower incidence of weight gain. Gastrointestinal complaints are more common with higher doses, and to avoid lactic acidosis, do not use in patients with even mild renal problems. Store in a tight container in a cool, dry place. And side effects of side effects are common, and advice about taking the drug with food or using slow-release tablets can help. For the lab test, obtain baseline and periodic kidney and liver function tests. Drug contraindicated in the presence of renal or hepatic insufficiency, and monitor blood glucose and HbA and lipid profile periodically. Monitor monitor known or suspected alcoholics carefully for decreased liver function. Monitor cardiopulmonary status throughout course of therapy. Cardiopulmonary insufficiency may predispose to lactic acidosis, and be aware that hypoglycemia is not a risk when drug is taken in recommended therapeutic doses unless combined with other drugs which lower blood glucose. Report to physician immediately SNS of infection which increase the risk of lactic acidosis. Example of that is abdominal pain, nausea, and vomiting, and of course the anorexia. And the significance of this drug is metformin was given to the patient to help to control the amount of glucose sugar in your blood. Metformin for gestational diabetes mellitus helps reduce risk for the baby and the mother by helping to reduce blood glucose level. Another factor in using metformin is it helps in preventing weight gain and keep blood pressure down. Several traits result that it is safe for the mother and the baby. It is also um, used alongside with insulin, as it means that less insulin is needed to achieve the desired result. So for the next drug, we have the glyburide, and the classification is sulfonylureas. Dosage is 2.5 to 5 milligrams per day, and that's per oral. The mechanism of action is increasing the secretion of insulin from beta cells in the pancreas. The indication of this drug is glyburide is used with a proper diet and exercise program to control high blood sugar in people with type 2 diabetes. It may also be used with other diabetes medications. Controlling high blood sugar helps prevent kidney damage, blindness, nerve problems, loss of limbs, and sexual function problems. The contraindication of this drug is low blood sugar, pituitary hormone deficiency, hepatic porphyria, a type of blood disorder where the red blood cells burst called hemolytic anemia, alcoholism, liver problems, severe liver disease, decreased kidney function, severe renal impairment, a body temperature higher than 101 degrees Fahrenheit, and a weakened patient. The side effects of this drug is diarrhea, dizziness, headache, heartburn, nausea, gas, and weight gain. The adverse effect of this drug is angioedema, urticaria, rash, pruritus, heartburn, vasculitis, hyponatremia, nocturia, agranulocytosis, hemolytic anemia, pancytopenia, thrombocytopenia, arthralgia, paresthesia, myalgia, blurred vision, and hypoglycemia. So for the nursing responsibility of this drug is instruct patient to take the medication at the same time each day. Take each dose as soon as remembered and left almost time for the next dose. Do not take if unable to eat. Explain to patient that this medication controls hyperglycemia but does not cure diabetes. Therapy is a long-term. Review signs of hypoglycemia and hyperglycemia with patients. If hypoglycemia occurs, advise patient to drink a glass of orange juice or ingest 2 to 3 tablespoons teaspoon of sugar, honey, or corn syrup dissolved in water or an appropriate number of glucose tablets and notify healthcare professional. And then encourage patient to follow prescribed diet, medication, and exercise regimen to prevent hypoglycemic or hyperglycemic episodes. Instruct patient in proper testing of serum glucose and ketones. Monitor closely during periods of stress or illness, and healthcare professional notified if significant changes occur. Caution patients to avoid other medication, especially aspirin and alcohol, while on a therapy without consulting healthcare professional. Advise patient to inform healthcare professional of medication regimen prior to treatment or surgery, and advise patient to notify healthcare professional promptly if unusual weight gain, swelling of ankles, drowsiness, shortness of breath, or dyspnea, and muscle cramps, weakness, sore throat, rash, or unusual bleeding or bruising occurs. The significance for this drug is glyburide is given because it has been shown to be as effective as insulin in achieving normal blood sugar level in mother having gestational diabetes mellitus who require treatment beyond proper diet. It is typically given to patients who cannot be managed with the standard first-line therapy, metformin. This medication will only help lower blood sugar in people whose bodies produce insulin naturally, and glyburide is considered safe in treating gestational diabetes mellitus. So the next drug is the insulin homolog, and the classification of this drug is rapid-acting insulin. The dosage is 10 units before breakfast, 6 units before dinner, and this is an IM drug. So mechanism of action binds to the insulin receptor heterotetrameric protein consisting of two extracellular alpha units and two transmembrane beta units. And the indication of this drug is treatment of type 1 diabetes, treatment of type 2 diabetes when other agents have failed, short-term treatment of type 2 diabetes during periods of stress, management of diabetic ketoacidosis, hyperkalemia, and marked insulin resistance. The contraindication for this drug is hypoglycemia, cresol hypersensitivity, and patients who are hypersensitive to homolog or to any of its excipients. The side effects of this drug are low blood sugar, weight gain, swelling in your hands or feet, itching or thickening or hollowing of the skin where you injected the medicine. The adverse reaction of this um, drug is hypoglycemia, allergic reaction, injection site reaction, lipodystrophy, pruritus, and rash. And the nursing responsibility for this drug are monitor the patient's food intake, exercise, and activities to ensure that the treatment is effective and that hypoglycemia does not occur. Monitor patient sensory losses to incorporate his or her needs into safety issues as well as potentially problems in drawing up and administering insulin. Ensure uniform dispersion of insulin suspensions by rolling the vial gently between hands and avoid vigorous shaking. Give maintenance doses subcutaneously, rotating injection sites regularly to decrease incidence of lipodystrophy. Give regular insulin IV or IM in severe ketoacidosis or diabetic coma. So monitor patients receiving insulin IV carefully, and plastic IV infusion sets have been reported to remove 20% to 80% of the insulin. Dosage delivered to the patient will vary. Monitor urine or serum glucose levels frequently to determine effectiveness of drugs and dosage. Patients can learn to adjust insulin dosage on a sliding scale based on their test results, and monitor insulin needs during times of trauma or severe stress. Dosage adjustments may be needed. And the emergency precaution of this drug is too much insulin lispro can cause hypoglycemia or low blood sugar. Low blood sugar can also occur if you use insulin lispro or insulin homolog with another anti-diabetic medicine. Changes in insulin regimen, example insulin strength, type of insulin and injection site, and delay or a miss of meal or snack, exercise more than usual, drink alcohol, or cannot eat because of nausea or vomiting or have a diarrhea. And the significance for this drug is insulin lispro or insulin homolog should be given to the mother who is diagnosed with gestational diabetes mellitus to increase her glucose level to achieve glycemic goals. Insulin transport glucose to the cell. Insulin lowers blood glucose levels, um, preventing pregnancy complications. Therefore, insulin is safe to pregnant women and experiencing gestational diabetes mellitus.